I'm Dr. Rupa Natarajan. I'm a family practitioner and I work at a federally qualified health center in the Bronx. In 2010, I was an OBGYN resident and I was rotating at a Catholic hospital in New England for about 2 to 3 months. When I was there one night on the labor floor, there was a 19-year-old woman who came in who thought that she had had her water broken overnight. She was 17 weeks along in the pregnancy, which is very, very early. So at this point, we evaluated her and confirmed that, yeah, her water had broken overnight. Now, this early in the pregnancy, unfortunately, this pregnancy had 0 chance of survival. So because this was a Catholic hospital and because there was a fetal heartbeat seen on the ultrasound, I was forced to give her only one option with how to manage this circumstance. So at this time, I was able to give her antibiotics and give her IV fluids and basically just watch her. If she had been at another facility, she could have been offered a procedure to end the pregnancy or induction of labor at this point. The procedure is a very common procedure called a dilation and evacuation. When it's earlier in the pregnancy, it's called dilation and curettage. It's basically a procedure that just surgically evacuates the contents of the uterus. It can be done at the bedside, it can be done in the operating room, and it takes about 10 to 15 minutes. It's not a very long procedure. Because she was with us, she got the antibiotics and she got the fluids and she started getting sicker. So her fever, she spiked a fever, she started having a racing heart rate, her blood pressure dropped, and she basically became very sick. So her uterus was infected at this point. And at this point, to save her life, she needed the procedure to end the pregnancy. Because of the religious directive, I had to transfer her to another facility when she was this medically unstable. So this involved me reaching out to a number of hospitals in the area, explaining the situation to many dismayed physicians who simply want to know, rightfully so, why can't you just do the procedure yourself? To which I said, I don't have an attending that can help me, and I'm also prohibited by this hospital. And the patient became sicker and sicker, and as we were transporting her into the ambulance, her pulse went higher, her blood pressure dropped further. In the ambulance, she delivered, and the baby died within seconds. I felt so guilty that I could not provide this patient appropriate care because of being at a Catholic facility. I felt guilty that the patient might think that somehow this reflected on her, on her miscarriage itself. So I felt really upset that being at a Catholic hospital restricted me from being the physician I wanted to be for this patient. I felt like I was not able to be her advocate to the level that I wanted to be. I felt that I was not able to provide good care to her like I should have. And I was just thinking to myself, if she and I met under different circumstances at any other hospital, I could have taken care of her immediately. I was told by my senior residents that there were certain things that were different when I was working at a Catholic hospital, such as that I would not be able to prescribe birth control to patients, I couldn't consent women for tubal ligations at the time of their C-sections, and that when reviewing options counseling with women, I basically could not talk about abortion or do any of those kind of procedures. And this is including women that had high-risk medical conditions where they should not be getting pregnant again for their own health. So overall, there were several instances where I feel that women were not getting appropriate medical care. I will not work in a Catholic facility again because I believe strongly in my right as a physician to care for my patients and to give them all of the appropriate medical options that are available to them. I do not believe in being constrained by directives that had nothing to do with science or directives that have nothing to do with the actual health of a woman. I think there's an injustice being done to women nationwide who are being forced to receive substandard care because of a religious directive that's being pushed forward by hospitals that are supposed to be there for the patients and not be pushing their own agenda.